So, hi, good morning, guys. I'm just going to go over kind of my experience with the procedure, post-op care, everything like that. So let me go ahead and share my slides. Okay. So when I first came and was aware that I had a tongue tie, we graded it kind of around a grade 3. But however, once I started doing the myofunctional therapy, things started to stretch out and everything kind of changed. So it ended up being kind of around a grade 2. My main chief complaint was chronic headaches. This is something I wasn't even aware was as bad as it was. I considered it to be occasional headaches about 2 to 3 times a week. However, once I started doing my myofunctional therapy evaluation, everything like that, I realized that's actually classified as chronic headaches. And I just thought it was a lot, not as bad as it was. I also experienced a lot of kind of neck and shoulder tension. And then within the past year, I noticed that I started to really clench and kind of grind my teeth, especially when I started waking up in the morning. I could just hear my teeth kind of like chatter against each other. Also, whenever I would touch my jaw with my face, it was some tightness here that I also was starting to be a lot more aware of. I never really grew up with speech issues except for maybe R sounds, and that's something I noticed on my own. No one ever really pointed out. It's just if I were to, for example, say the word transition, I would have to really emphasize that R sound. And that's just something that was always in the back of my mind. Never really thought it was an issue. I went ahead and did a CT scan and a sleep study just as kind of screening, make sure that I wasn't at risk for anything. And that initial sleep study did show slightly elevated RDI of 10.4 and AHI was pretty low of 1.9. As you can see here, I went ahead and did a CT scan. It shows kind of like an open airway, so I knew that that wouldn't be an issue for it. And then also just slightly low tongue posture, not all the way down, but wasn't all the way up, sealing my palate either. So as you guys saw with the video, everything went smoothly. We actually didn't anticipate going into the muscle, but you also never know until you actually start dissecting it. So it was nice for me to kind of see it afterwards too. But because we kind of did partial genius glossectomy, we did go deeper into the muscle. I did experience a lot more pain. Throughout the video, you can see that Dr. Zoggy did go ahead and give me more anesthetic every time he went deeper into the muscle. Although I didn't feel it during the procedure, I definitely felt it after. So I was kind of happy that he was putting in that Marcaine and putting in that lidocaine, because that did last me for at least another 45 minutes after the procedure. And then I started to kind of really feel the pain. And I mediated that initially just with ibuprofen, which is what our normal protocol is. So I took about 600 milligrams kind of immediately after the procedure. And then that night when I went home, it was still pretty sore. So I just went ahead and just took a tramadol. And then that night, I know it was kind of difficult to chew. So I went ahead and just kind of, I think I just had like a smoothie and a soup, something like that. Okay, and then the next day, pain was still pretty bad. It was still kind of difficult to chew. I kind of took the ibuprofen around the clock, and then towards nighttime, I again took the tramadol. I was still kind of just sticking to really soft foods. I remember drinking smoothies, having some yogurt, things like that. So it's just good to be aware of the pain, and it is normal and is expected. It's just nice to know. By day 2, I would say the pain kind of dropped down a lot. I believe I only took about maybe 2 ibuprofens throughout the day, and I started to kind of chew a little bit more softer foods. So I remember at this time I was eating some pastas, things that weren't too chewy, and things like that. And it's also nice to know, I like taking all these photos just so you can physically see. This is the start of the granulation tissue, and then the sutures are still kind of all in place. Okay, by day 3, the pain dropped significantly. It was only sore when I was eating or kind of chewing or speaking extensively. I know by day 3, I was back to work. I was talking to patients. I was talking to everything kind of normal. And I remember just taking the ibuprofen in the morning just as a precaution because I didn't want to have pain throughout the day. But other than that, I didn't feel much pain or discomfort. Again, just stick to soft foods, nothing too chewy, no things like meat, things like that are a little bit harder to chew. And as you can see, there's also still the granulation tissue starting up to fill up at the top, and then kind of towards the bottom. And then I know that a lot of the sutures at the very tip started to kind of dissolve and fall out. And the reason for this redness was because I started to see the granulation tissue. I used the surgical toothbrush, but they were still pretty in there, so that was my fault. It was a little bit inflamed, but I was aware of it, and I just didn't use the surgical toothbrush for the rest of that day. By day 4, again, as you can see, as the sutures start to fall out, the wound is a lot more open, and then for that reason, the granulation tissue comes in to kind of fill that. Again, there was very minimal amounts of pain, only when I was moving the tongue physically to do exercises. For example, if it's doing my side to sides, doing my caves, I could still feel the soreness. But on a normal basis, talking, things like that, I didn't feel any type of discomfort. Okay, and by day 5, again, only sore when I'm doing the therapy exercises. I was eating perfectly normal, and then as the time goes, it just kind of progresses the same, where the sutures are falling out and the granulation tissue fills in. By day 6, I believe almost all the sutures all came out. There's just some granulation tissue at the very base of the tongue right here. Again, it's only sore when I'm doing kind of the stretches and the exercises. Day 7, so a week out from the procedure, again, pretty much same healing, granulation tissue slowly starting to go away. And at this time, it felt I was comfortable enough to do manual stretches. I know in the past, every time I try, if it was too sore, I would kind of take a step back. But then at this time, the manual stretches were super helpful because things started to kind of feel a little bit tight. Everything felt like it just needed kind of that extra stretch. And then by day 8, very similar thing. And then these lecture slides are in the Digify folder, but if you go back and look at every slide of my caves, you can actually see that my cave is getting bigger and bigger as the days go by. So I think that's one, with everything healing, and then also with those manual stretches, it really helps the tongue kind of elongate and kind of lift up as much as you can to get that maximum mouth opening. Day 9, very similar thing. Again, just continued with those manual stretches, and then my mouth opening just kind of gets better and better as the days go by. And then by day 10, I again started to do those manual stretches. And this is actually the day that I started to feel some contraction. Contraction is extremely normal. You kind of feel it starting around week 2 of healing. And that's something I think is really important to tell patients. When you kind of go in for the release, everything's loose, everything feels really good. And then as everything heals, it wants to contract and go back to normal. You just have to reassure them that it's normal to continue those oral massages, continue those manual stretches, and you'll get kind of final results around 1 to 2 months post-op. So this is me about 1 month post-op. Again, you can see my caves have significantly improved after just 1 month. And then just things that I was starting to notice, just when I'm eating, it's a lot easier to kind of clear out the food in my mouth. And that's something I never really knew was an issue until I had the release, that I wasn't able to reach certain parts of my mouth until I had it. Again, I still was feeling contraction, so I just continued those manual stretches about 3 to 4 times a day. And then about 2 months post-op, I realized that my speech was a lot more fluid, but between 1 and 2 months, the other changes continued, still had increased mobility, my caves were really good, and things like that. So I just continued those manual stretches, just with less frequency because it didn't feel as tight anymore. And by 3 months post-op, as I said before, one of my main chief complaints was chronic headaches. I would feel them kind of at the base of my neck all the way to my temples. And since I had the release, by now it's about 4 or 5 months now, I've had maybe 1 or 2 headaches, if even. So for me, that's really such a drastic change. Um, so that pretty much brings us to where I am today. I'm about the same in terms of improvements and everything like that. I'm really happy that I had the release. One, because my headaches have significantly improved. And then also, it's just a great resource to provide to patients, especially when you tell them that the healing, the pain, what do the sutures kind of look like when they're falling out, granulation tissue, what is that, things like that. So it's a great resource, not only for ourselves, but even to provide to patients to let them know kind of day by day what everything's looked like. And then let's see, let me go back in the chat, see if there's any questions.
I'll help you actually navigate the questions, Gloria. We have a question asking, did you have any or experience mouth breathing pre-op? If so, did you feel it was easier to nasal breathe after the procedure?
Yeah, so in general, I was already kind of a nasal breather. So I didn't really have open mouth breathing. That wasn't one of my issues. But I have seen definitely in patients that that has improved.
Great. And I know you touched on the stretches and the manual therapy you did, and we're going to be inviting Sonda right after you to really delve into the post-op and the wound healing in greater detail. But Dr. Patrick asks, when did you start the stretches? So if you could just quickly go over what you did there again, that would be phenomenal.
Yeah, so I know for me, I tried to start doing the manual stretches around day 4, day 5, but at that time it was a little bit too sore still. Every time I pulled it, it was a lot of tension underneath. So I just kind of let the sutures take hold, and then it was until I did the manual stretch and it felt like a really good stretch underneath. It didn't feel soreness, nothing like that. So I believe that was around day 6 that I started to really do those stretches about 3 to 4 times a day.
Beautiful. And then Lenore is asking, did you do any mouth taping at night or needed to after the surgery?
No, so again, I always have no nasal obstruction, nothing like that. So I habituated nasal breathing. It wasn't really a mouth breather, but again, lip taping is a good tip if in the case that you are one.
Beautiful. And then before I invite Sonda to speak to the group, Gloria, in terms of all of the experience you've had, not only communicating your own experience with patients, but also addressing all of the questions that come by way of the patients, what would you say is one of the most reassuring or positive, like, talking points that the group can share with patients when asking about what the experience is like, in terms of going through the release?
Yeah. So one of the main concerns that patients always kind of bring up is about kind of the swelling inflammation afterwards. A lot of the patients that do come, whether they're adults, they have work within the next week, or kids have school, they have concerns about speaking, things like that. It's a very, very procedure is like very easy to recover from. Again, 3 to 5 days of soreness and pain. It's just uncomfortable, but it is tolerable. And it's also really good to actually encourage a lot of talking. And then also we get a lot of concerns about the contraction phase. It's good to let the patients know that it is expected. Around week 2 when everything's healing, it's really good to know that the contraction, you'll feel a little bit tight. Just reassure them that it's normal. There's oral massages that you can do. There's manual stretches that you can do. It's not reattaching immediately at week 2. There's just a lot of little steps that you can encourage them to do to kind of reassure them of that.